Hi everyone, my name is Eva Zuhuis and today I'm joined by Professor Gurch Randhawa. He's a professor of diversity and public health and director of the Institute for Health Research at the University of Bedfordshire, and we're going to talk about his role in kidney care. Thank you, Professor Gurch, for joining me for this podcast for the RPSG Education Biobank.
My pleasure to be here. Thank you for having me on.
Let's start with the first question. Please tell us, who are you and what is your background?
Sure. So I've been working for over 30 years now, looking at health inequalities at various parts of the life course, ranging from preconception to maternal care to child health to adult health and things like end-of-life care, organ donation. I have a specific interest in kidney disease. My PhD was looking at the epidemiology of kidney disease amongst South Asians in the UK. And I've been running a research program funded by very eminent organisations to look at the whole kidney care pathway from prevention to treatment and management. And that's me in a nutshell, really.
Thank you. So what does your main job entail?
So my main role is running a research centre at the Institute for Health Research, working with some very talented colleagues and PhD students, and we also run a public health master's programme at the University of Bedfordshire.
Thank you. What is your main role in kidney care?
So I guess it's about undertaking research across the whole care pathway. So I'm particularly interested in how we can improve health checks to make sure that people ideally don't have any kidney health problems at all, but also making sure that people access kidney care much sooner along the pathway. So a lot of the studies I've done have shown that too many people from specific minority ethnic communities, they present much later with their kidney problems, and then their rate of progression is much quicker, which means that many of them therefore require either renal replacement therapy, that might be dialysis or transplantation. So I'm also interested in looking at, for example, how do you in the longer term reduce kidney health problems and reduce kidney failure, but also in the short term, how do we increase, for example, kidney donation, be that living donation or deceased donation, to solve the issue of many people requiring kidney transplants.
So you'd also be looking into how to recruit more kidney donors.
Yes.
Great. What is the latest research in your field?
So the most recent study we've published was we've just had a PhD student who was working in collaboration with an organisation called Mohan Foundation in India. And particularly in India, they're wanting to increase organ donation rates. But as you and your listeners may know, India is like the size of Europe. So each state is the equivalent to a European country. So even within each state in India, they've got massive variation in organ donation infrastructure, organ donation rates, but also public views on organ donation. So our research has shown a geographical divide in organ donation rates, and it's all about how do we build a social capital infrastructure that normalizes the act of organ donation. So for that work, the PhD student who's now graduated, his name is Britzer Vincent Paul, did a fantastic piece of research where he used a socio-ecological model to try and explain why healthcare systems and public need to work hand in hand to make sure that organ donation is discussed widely, and also that kidney health is discussed widely, so that people realise that you can actually manage your kidney problems if you access care sooner rather than later.
And that is internationally mainly, or was it mainly in India?
That piece of work was done in India, and I've currently got another PhD student who's doing some work out in Qatar. Qatar's an interesting place in that it's got a population of about 3 million, 90% of which is from outside of Qatar, 10% of the population is Qatari. It's a very multinational. So again, similar challenges about how do you engage with different ethnic communities with the whole conversation about kidney health, but also about organ donation.
Interesting, thank you. What advances do you think will be there in kidney care in the next 5 years?
I guess there are bound to be with the rapid developments now around genomics that the hope is that there'll be some huge progress in genomic medicine and kidney health, which will be great. But I also think we need to solve the fact that there are just too many people. For example, in the UK, if you take the UK's example, nearly 1 in 3 people waiting for a kidney transplant in this country are from a non-white background, and we need to solve that problem. So we really do need to work out why there's such an overrepresentation of minority communities on kidney transplant waiting lists, because these conditions are manageable and preventable. And also we need to rapidly increase the amount of transplants taking place. And that can only happen if we normalise the act of organ donation. So we're still a long way away in the UK of giving organ donation visibility. So a lot of public campaigns still amplify stories about people needing a transplant or a recipient, and that actually doesn't normalise the act of organ donation. So the only way you can normalise the act of donation is if you give far more visibility to living kidney donors or to donor families of people who've donated after death. So the example I always give people is many people have heard of the singer Selena Gomez. She's quite famous. So most teenagers and school children, when I do school engagement activities, they all know Selena Gomez has had a kidney transplant. When I ask them who their donor was, very few people know. It's her best friend, Francia Racer. And that, in a sense, is the challenge, that we still haven't got the confidence to openly talk about donors in the same way we do about recipients. And I think that has got to be a 5-year challenge.
Thank you. What advances would you like to see in kidney care?
Well, I would like inequalities to be a thing of the past, and that's only going to happen if research studies related to kidney care are more inclusive and diverse. It's only going to happen if research teams are more diverse in terms of gender, ethnicity, etc. And it's only going to happen if policies really reflect the sort of equality, diversity, and inclusion agenda. So it does mean that policymakers need to think about inequalities in a more sort of systemic way, in a strategic way. And we shouldn't just take it as a given that, for example, as I said earlier on, it should be unacceptable that minority communities make up nearly 3 times the kidney transplant waiting list compared to the general population. And it should be unacceptable that they wait much longer for a kidney transplant. And it should be unacceptable that they make up so few donors. And we don't have that urgency. And I would like that to be an extremely urgent issue if we're serious about equity in kidney care.
I see, thank you. Does that also mean that you're looking into reaching out to minority ethnicities in the UK to see if they're willing to transplant a kidney?
Well, I think so. I think, the UK NHS Blood and Transplant do fund something called a community grants programme. But that's really sort of the tip of the iceberg. The amount of budget they have is relatively modest. And if you're really serious about solving this kind of problem, you have to invest based on need and demand. Therefore, there needs to be a much greater investment if you're serious about equity.
So, Professor Gurch, thank you very much for your time. It was very fascinating to hear about your role in kidney care. Do you have any final thoughts before we close?
I guess my only comment is if we're serious about offering kidney care to everybody, regardless of their socioeconomic background, their ethnic background, then we have to invest accordingly. We have to include people accordingly. And we have to focus, in my opinion, at least, on 3 outcomes. So that's access to care, that's experience of care, and the outcomes following care. And unless you look at all 3 of those components, there is a chance we won't deliver on equity.
Thank you again, Professor Gurch, and thank you, dear listener, for joining us for this interview. We hope this conversation was insightful into the world of kidney care, and stay tuned for more interviews with other professionals involved in kidney research. See you in the next episode.